Hey, it's Dr Rahman here at the Dr SR Clinic. Thanks for joining us again today. Now, of course, most of you will know that we are the premier aesthetics clinic for Newport in South Wales, and many of you will also know that we do a lot of work with the removal of small tags and moles from the skin. Very common occurrence. Normally quite easily removed with local anaesthetic injections, and then we burn them off gently using a device called cautery excision. Comes up very nice and cleanly, minimal scarring, minimal downtime, and you can basically get back to the business straight afterwards. And we get a lot of requests to do this. What you may not know is that we have a lot of also requests for bigger lesions as well. And today I wanted to talk about our service of cyst removal. So a lot of requests come through on this. Cysts are benign pockets of fluid or of material which develop under the skin. They can appear anywhere, but the most common ones that we're called on to treat tend to be on the head and on the back. They are harmless, but they can be slow growing, they can be annoying, they catch on clothes and things, or if you're combing your hair, you might feel against that. Now, I've had the very kind permission from a young gentleman patient of mine recently to show some pictures of his. Now, he had a slow growing cyst on the top of his head, as you will see just over there. This particular cyst is 5 centimeters in diameter, so we're talking approximately this size. It's a fair size one, and like I said, it had been growing for some time for this gentleman. Not painful. We examined and discovered it was entirely benign. It was clearly bothering him. He was actually thinning of hair, and it was becoming more visible. I'll come back to that later. As you know, hair treatment is very much one of our specialized treatments here, and hair restoration. So in any case, so we were able to treat him again with local anaesthetic. Now, if you're feeling squeamish, you may want to look away, because this next picture is of during the procedure itself. So you can see this is the material that we removed, and in this next picture, you will see that's what it looks like sitting out on the table. Fair sized cyst there, and we closed it up nicely. Again, he's able to resume pretty much normal duties, and will heal up extremely well. He's very happy with the results. So it's a very common procedure. If it's something that you're interested in, something you might need help with, then get in contact. All the details are down below. And if you have any interest or questions about particularly hair treatment and hair restoration, we will cover some more of that in a separate video as well. But do please get in contact about that. In the meantime, I'm Dr. Rahman, and many thanks for listening, and I'll talk to you on the next video.